I'm Dr. Joseph Shvidler, and I'm a double board certified facial plastic surgeon currently practicing at the Seattle Facial Plastic Surgery Center in Seattle, Washington. So Mohs reconstructive surgery involves repair of the tissues that were lost after skin cancer was removed. It's usually done the same or next day after surgery. It's usually done under local or general anesthesia. We utilize things like skin grafts or flaps to rebuild the missing tissue. These grafts or flaps are taken from adjacent areas where the defect is to have a nice color match. Recovery is usually a week or two. Sometimes we require multiple stage procedures depending on the size and location of the defect. But our ultimate goal is to restore the pre-surgical form and function to get you your nose or face back. Yeah, one of the biggest reasons I like to do Mohs reconstructive surgery on the face and nose is that I'm able not only to restore the form but also function. So while the patient only sees the outside appearance of their nose being restored, on the inside there's a lot of work that has been done to restore their function so they're able to breathe through their nose the way they did before the surgery. Mohs surgery involves a special technique where a dermatologist removes skin cancer, for example, basal cell carcinoma or squamous cell carcinoma, from facial or nasal tissues, and they look under a microscope and they determine whether the tumor is completely gone or not. And I usually get involved after that's been done, where there's a skin or soft tissue defect in the nose or facial structures in what I call a high real estate area. For example, on the nose, around the lip, on the ear, around the eye, on the brow. And those areas are pretty challenging because if you can imagine, those are topographically three-dimensional structures. There's not a lot of mobile skin there. Sometimes could be very difficult to reconstruct. So I usually will assist my dermatology colleagues in helping rebuild those structures, and I use my background as a ear, nose, and throat and facial plastic surgeon, and with my artistic background, I'm able to kind of envision how I can rebuild those structures, and we use a combination of skin grafts or flaps to restore the form and function. We do it for the nose, face, ears, lip, brow, eyelid area. When my patients are done with Mohs reconstructive surgery, they notice that their nose has been restored to their pre-surgical state, that their nose looks like the way it was before, but also that their nose functions just as well as it did before surgery. And that is really important to me, to make sure that not only are they looking their best, but also that their nose functions their best as well.